When responding to an infant who appears unresponsive, begin by ensuring scene safety using SAFE. Approach the infant and try to startle her by shouting. Then, tap her on the foot or shoulder. If the infant is unresponsive and there are bystanders available, send someone to activate EMS. If the infant is not breathing normally with a detectable pulse, begin CPR.
1, 2, 3, 4,
Get
5,
into position
6,
and perform
7,
30
8,
chest
9,
compressions
10,
followed
11,
by
12,
2 normal
13, 14,
ventilations.
15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
To perform compressions on an infant, place the infant face up and lying on a firm, flat surface. Maintain the infant's airway position with one hand. Place 2 fingers of the other hand on the lower half of the breastbone, 1 finger width below the nipple line. Be sure the fingers are not pressing on the lower tip of the breastbone. Push straight down with a force sufficient to compress to 1/3 the depth of the diameter of the chest. Release pressure completely at the top of each compression. Do not allow your fingers to lose contact with the chest wall. Without pausing, continue into the downstroke of the next compression. Continue chest compressions in this manner at a rate of at least 100 to 120 times per minute for 30 compressions. Next, move to the head and perform 2 gentle breaths using just enough force to cause the chest to rise. Do not overinflate an infant's lungs. Techniques for using a mask on an infant vary. Typically, the face mask is turned 180 degrees, so the tapered end is toward the chin and the mask is covering the infant's entire face. Follow the manufacturer's recommendations for use on an infant. To provide rescue breathing, open the airway. Use gentle pressure with one hand on the infant's forehead to tilt the head slightly backward. Avoid overextending the infant's head as the airway is small and easily collapsed. Give breaths at a rate of 1 breath every 3 to 5 seconds with a delivery time for each breath of about 1 second. Remember to allow the patient to completely exhale between rescue breaths. If your breaths are adequately inflating the lungs, you will clearly see the chest rise and fall. After approximately 2 minutes, or the completion of 5 cycles of 30 compressions and 2 breaths, take the infant with you and call EMS if not already done. Check for the signs of circulation. If circulation signs are still absent after more than 5 but less than 10 seconds, resume CPR. Reassess for the return of circulation every few minutes. Continue CPR until EMS arrives or the infant begins breathing on their own.
3, 4, 5, 6, 7, 8, 9, 10.